about drinking alcohol in moderation?
Alcohol in moderation is okay, but recognize some of the effects of alcohol so alcohol can raise your blood pressure. So that's some things that people don't know about alcohol. Alcohol can also cause insomnia, but it's a sleep maintenance insomnia. So if you're trying to fall asleep, alcohol will help you fall asleep, but then you will wake up throughout the night because you'll urinate more because that's part of the effects of
Yeah.
drinking. Alcohol moderation is considered okay. Certain forms of alcohol have antioxidants, specifically all of it has antioxidants, red wine in higher concentrations. And that's why red wine is recommended and considered heart healthy. But
Okay. But one glass, not a whole bottle.
4 ounces a day.
Oh, I thought you said 4 glasses a day. That's a whole bottle.
Ounces.
So this is real important for women because I had a boss years and years and years ago at the bank, and she never had a mammogram. So I wanted to just ask you to kind of go through those core essential exams that we need to have once a year that women neglect. You think in 2021 we're doing it all, but we're not. So what are some of the core exams that we need to have?
Okay. So it starts at age 21. 21 is the age of your first pap smear. Pap smears are a screening test for cervical cancer. And typically they're done in conjunction with a pelvic exam. So they start at age 21, but they are not annual. So pap smears, if you've never had an abnormal pap smear, then your pap smears are once every 3 years. And some doctors still do them annually, but technically the recommendation is once every 3 years for women who have no abnormalities on pap smear ever. That changes if you had an abnormal and exactly what the is. If high grade abnormality, you may be in a category that has to have a pap smear done every year. If it's low grade, typically it's a few years and then you return to routine screening. Next one after that, age wise, is typically your mammogram, which starts at age 40. And the purpose of the mammogram at age 40 is for baseline. So those are your baseline mammograms. Some women go get mammograms earlier than that, 35, 30. Sometimes doing that, the breast, as we're younger women, breast tissue is going to be a lot more dense. And so because of dense breast tissue, they'll see things that look like a lump, but it's not a lump, right?
Right,
And
right.
like one. But so screening mammograms at 40, and that's to get a baseline. Some women do mammograms every year, and some women do them every 2 years. I generally recommend to my patients every year if you have any family history of any person that has breast cancer in your family, then they should start at age 40 we'll put a star by that and I'll come back to that. And then they'll be every year until you decide that you don't want to do them anymore. For most women, for most of my patients, I tell them somewhere around 70, 75 is when I say, hey, I'm not doing this anymore. I do them until they're 85, until they're 90. There's no end recommendation on mammograms. So they